How are prostate cancer PSA gray zone results interpreted? Imagine getting your blood test results and seeing your prostate-specific antigen levels fall between 4 and 10 nanograms per milliliter. That range is often called the gray zone because it's not clear whether it indicates prostate cancer or benign prostate conditions. This ambiguity can be confusing, but understanding how doctors interpret these results can help you navigate the next steps. Only about a quarter of men with PSA levels in this range actually have prostate cancer, so additional tests are essential to clarify the situation. When a PSA result lands in the gray zone, doctors don't rely on that number alone. They look at other factors to improve accuracy. One important measure is PSA density, which involves dividing the PSA level by the prostate volume measured through imaging. If the PSA density is high, such as above 0.15 nanograms per milliliter per cubic centimeter, it suggests a higher risk of prostate cancer. This helps distinguish whether elevated PSA is due to benign enlargement or potential malignancy. Age and prostate size also influence PSA interpretation. As men age, their prostate tends to enlarge, which can naturally raise PSA levels. Adjusting for age and prostate volume makes the assessment more precise. Some doctors use formulas that combine PSA, age, and prostate size to estimate the likelihood of cancer, helping to decide whether further testing is needed. Imaging techniques like multiparametric magnetic resonance imaging are increasingly valuable in this context. MRI scans can identify suspicious areas within the prostate, and the results are scored using the Prostate Imaging Reporting and Data System, or PIRADS. Higher scores indicate a greater chance of significant cancer. If MRI shows concerning findings, targeted biopsies can be performed to confirm or rule out cancer. In addition to MRI, newer molecular and imaging biomarkers are emerging. For example, scans like 68-GA PSMA PET cohort can detect prostate cancer more precisely, especially in cases where PSA results are uncertain. These advanced tools, combined with clinical information, help doctors better assess the risk before recommending invasive procedures. Risk stratification models also play a role. These models incorporate PSA levels, imaging results, age, prostate size, family history, and other factors to estimate the chance of having a significant prostate cancer. This comprehensive approach helps avoid unnecessary biopsies and reduces the risk of overdiagnosis of indolent disease. In practice, when PSA results fall into the gray zone, doctors take a careful, personalized approach. They consider PSA kinetics, how quickly PSA levels are rising, along with prostate size, age, family history, and physical exams. Imaging results are integrated into the decision-making process to determine whether a biopsy is warranted. The goal is to catch aggressive cancers early while avoiding unnecessary procedures for benign conditions. Overall, interpreting PSA gray zone results involves a complex, multifaceted process. It's about combining PSA levels with prostate anatomy, imaging findings, and individual risk factors to make the most informed decision possible. Always remember that each person's situation is unique, and consulting with a healthcare professional is essential to get personalized advice. This careful, evidence-based approach helps improve prostate cancer detection and patient outcomes, ensuring that no one is overtreated or left undiagnosed.